Hello, I am Elizabeth Patton, and I will be presenting a presentation on the subject equine assisted psychotherapy versus clinical psychotherapy. My research question for the proposed study is EAP more effective than clinical psychotherapy in at risk youth? The importance of the topic and research question are the following: patient treatment, alternative methods, cost effectiveness, and referrals. Patient treatment addresses what is the best and most effective way to help at-risk youth. Alternative methods: sometimes certain therapies either do not work or a patient or caregiver is not open to a certain method. Cost effectiveness: is the cost benefit better with EAP or clinical psychotherapy? EAP can be very expensive upfront and not be covered by certain insurances. However, is it more effective than clinical psychotherapy, which may be longer and need frequent returns to therapy? Referrals: mental health clinicians, medical doctors, and past clients are individuals who refer parents, guardians, courts, child agencies to what specific treatment a child should undergo. If there's not literature on the proof, then there will be a snowball effect on lack of funding, clients, and practitioners. The literature review that I am going to discuss is Lentini's and Knox's 2015 quantitative review of 34 studies and 13 qualitative studies. Some issues that they determined were studies were compromised, more research needed, randomized participants were needed, it needed to have a longitudinal design, evaluate the cost effectiveness needed to happen, increase the sample size, and improve controls. There are two relevant studies which I used in my past week's work, and they are shown on this slide. In McCullough et al., the colleagues looked at how youth dealt with post-traumatic stress in a comprehensive quantitative pre-test, post-test method. 11 children ages 11 to 18 attended 8 weekly EAP sessions for 1.5 to 2 hours. The results indicated that PTS symptoms decreased and the human-animal bond increased, and also this bond may have protective factors which decrease PTSD symptomology. The weakness with the study, as mentioned in literature review, is no control group. Bergen completed a qualitative study which looked at at-risk foster children. This had several issues that the literature review mentioned, such as participants were of a convenient sampling, small sample size of 7, and no control group. However, many positive benefits were seen with this group. Some main themes that emerged were related to confidence building, self-esteem, a sense of mastery or self-efficacy, empathy, and the opening up of positive opportunities. This was then further grouped into 4 main themes that the participants named in their own words. The themes were Queen of the World, I can't believe I'm doing this, I can give them love, and I didn't know I could do that. What type of study and what methods should be used were questions I asked when evaluating my potential study. I believe mixed methods, triangulation, and grounded theory will all help towards shaping my research. This is the rationale. Mixed methods: the study will look at both quantitative and qualitative triangulation, or categories, sorry. Triangulation is the integrating methods in order to verify and understand more. And grounded theory questions a range of psychological processes, asking what is happening, how, and why. Ethical issues are guided by the American Psychological Association. They wrote the ethical principles of psychologists and code of conduct, which help dictate how mental health professionals should behave. The ethical issues that the study faced are all within Standard 8. Some apply more than others, and all these areas can be followed by conforming to the APA's standards. I did not include Standard 8.07, Deception in Research, since the study will be transparent. Conclusion: the study of the effectiveness of EAP versus clinical psychotherapy in at-risk youth will benefit from a mixed method, triangulation, and grounded theory approach. Ethical considerations will be adhered to at all times and help shape how the research proceeds. There are many things to consider when attempting a study. Looking at a literature review is helpful in seeing what research has been done and compared it to what still needs to occur. The type of study needs to be determined, whether qualitative, quantitative, or mixed, then specific methods should be employed. Lastly, ethics and conduct must be at the forefront and paramount in conducting research. These are my references. Thank you for your time.